Hi everyone, so I have a few updates to give, so I'm going to try to go through quickly, keeping to the timeline. So the last kind of big piece of news coming out of MD Anderson, they believe that what Javed has is something called peritoneal mesothelioma, right? This is what they believe it is. And so what they're thinking is that they might have been an asbestos exposure at some point that has now caused this tumor, right? So this is what they strongly believe. And with this type of cancer, there is no cure. The only thing to do is to remove the tumor. And we've been saying this for a long time. And so again, key is getting that tumor to shrink, right? And so what they're doing now, they have put him on this other course of chemotherapy. It's completely different than the first set that he had been having. And so he's actually already had one course of this new chemo. And what they're saying is if the tumor responds to this new set of chemo, then it brings them closer to confirming this peritoneal mesothelioma diagnosis. So right now, we're still waiting to see what happens with this chemotherapy. And our hope is that this tumor has not been, but that it shrinks so that surgery can be carded. However, another kind of parallel thing happening, which is not at all positive, is that one fallout from the previous set of chemo, I had touched on it before, it has caused some damage. And one of the things right now Javed is dealing with is accumulation of fluid around his heart. There's a medical term for that. It is, I can't think of it right now, but essentially what happens with that fluid that's forming around the heart is that it puts pressure on his heart, so he gets very winded. It's very hard for him to breathe, things like that. Actually, now Javed is in the hospital. He's in the hospital right now. He'd also gone into the ER this past weekend, again, because his difficulty breathing. So it's very scary. This is something that, it's very upsetting because, like I said, this was caused by the previous chemo treatment, which actually wasn't doing anything at all. So that's very hard for us to deal with. But this is so bad that right now he is carded for surgery tomorrow to drain this fluid from around his heart. So he's in the hospital right now, and as far as we know, the cardiologist is going to see him tomorrow, and the idea is that they need to drain that fluid that's putting all that pressure on his heart. And I believe there may be some kind of a pouch device or something like that that they attach to collect that fluid. So again, this is something now in parallel happening along with his cancer diagnosis. So, things are coming, some things are good, some things are bad. But we're just continuing to keep positive. Please continue to pray for Javed. Please pray for his wife. I haven't talked a lot about her necessarily in my videos, but she is really the MVP in all of this. She is the champion. She is the one finding the strength. She is alongside him physically. She is there, to these appointments, the ER visits, emotionally. I mean, she is the one totally standing in the gap and fighting for Javed right now. So please also keep her in your prayers. And, let's hope that the surgery tomorrow goes well, that his heart is able to function the way it should, and that, again, in parallel, this chemotherapy, this new one that he has, attacks that tumor.